Welcome once again. We hope you had a great first session. So, some of our colleagues are still joining. All right. So, this is the day one evening session. We'll be starting shortly. We just want to accept more people into the room. Okay. Welcome, everybody. Just give us one more minute to welcome everyone who they're still in the waiting room. All right, so we'll kick off now, and I'd like us to start with a brief recap of what we learned in session one. So, if you were in class this morning, we had a session on introduction to M&E for digital health, and that was taken by Justus Ashaba, who walked us through that brilliant presentation. So this evening we will be continuing the workshop on designing an M&E framework for digital health. But before that, let me share the screen. I want us to take a quiz. So please go to slido.com, put in this code. We have 6 questions for you just to test your knowledge of what session one was about. So let's quickly go to slido.com, use the link, use the code on the screen, and we'll kick off the quiz very soon. So let's quickly answer. Michael, I'm not sure if Michael's spoken.
Hi everyone, can you hear me?
So let us take the quiz. It's on the screen. So the first question is, which statement best distinguishes monitoring and evaluation? Justus did a very good justice to this during the session. So I think we should get the answer. Okay, so I'll be moving next to the next question. So that's the answer. Monitoring is continuous, while evaluation is the fulfillment of objectives and extrinsic impact. So we have Anat leading on that. Congratulations. So next we have the next question. You have just 20 seconds to actually answer. So fastest fingers. At which stage should a digital health implementer start thinking about budgeting for M&E? After, at the planning stage, during final evaluation, or during the midterm review? Time up. At the planning stage, definitely. We have Maha on the leaderboard. Congratulations for leading that. So next, what is the primary focus of M&E during the midterm review stage? So you have just 7 seconds left. Yeah, so the answer is course correction and early results. That's the primary focus of M&E during the midterm review stage. So let's see who got that. So Ma is still leading. Fourth question, which of the following questions is not a key component of monitoring? If you remember just this session, if you were paying attention. I'm currently on a short visit in Nairobi, so I'm so glad to be away from the winter in the UK. I look forward to connecting with everyone as well. Okay, so let's see the answer. Yeah, so C is the answer. You're asking if the digital health initiative cost effective is compared to non-digital alternatives. So let's see who got that. So Maha is still on the leading board. Now to the second to the last question. According to the literature extract that Ashaba shared, what is the most concerning challenge in digital item management? So that was the last slide he shared during his session. So want to see who was paying attention to that particular slide. Okay, so time up. Let's see. Yes, so it's limited evaluation skills and capacity. If you remember the graph he projected, that was at the bottom. So if you start from there, that was the most concerning challenge that people identified during the research. So let's see. Wow, Ala has taken the lead. So to the last question now, let's see if Ma is going to come back to the leading position. From Mr. Justice's session on M&E, what question should monitoring answer? This is just to test if we're paying attention. 6 seconds left. All right, time up. Are we doing this right? So let's see. So congratulations to Alal for finally making it back to the leading board. So thank you so much for joining our quiz. We would be having this at the beginning of every session just to check if you were paying attention during the workshop. So back to the session now. We have session 2 at the moment, about to kick off, and we have 2 facilitators who will walk us through this session. I hope Emmanuel and Elizabeth is on the call, so you can just say hi so I can promote you so that you can share your screen. Emmanuel and Andrew, you're on the call, so if you could confirm if Emmanuel and Elizabeth is on the call. Hi, Andrew, I hope you can hear me.
Maybe I should confirm for myself. I am on.
Okay, you're on. All right.
Yeah.
So I guess you joined with Andrew. So it's Andrew I'm saying, not Elizabeth. That's why it was confusing. Okay. So I'll give you the floor now for your presentation. Thank you.
All right. Thank you so much for that recap. Welcome to today's workshop on monitoring and evaluation for digital health. This session is basically about designing an M&E framework for digital health. My name is Elizabeth, and I have experience in implementing and evaluating digital health interventions. I'm really excited to guide you through today's session. Maybe just a quick one. Are you seeing my screen?
No, not yet.
Not yet. Let me share it. Just a moment. Can you see it now?
No, not yet.
How about now?
Yes, yes.
All right. Today's session is about designing an M&E framework for digital health. Maybe just a quick one. How many of you have received an SMS reminder for a health service, maybe vaccination or a clinical appointment? Someone feel free to unmute and speak and share with us. Yes, Justus, your hand is up. Hello. Can you hear me?
Yes, we can hear you.
Oh, perfect. Any volunteer? I would love to make this participatory as much as possible. We are not seeing each other, at least we can hear from one another. Is Andrew saying something? Maybe Emmanuel. Let me just call out on the participants. Please feel free. I would love to have this participatory as possible. Someone called Barbara, are you there?
Yes, I'm here.
That's perfect. Have you ever received an SMS reminder for a health service?
No, I haven't.
No, you haven't. Any other person? We could hear from Favor. Favor, are you there? Okay.
Yes, I'm here. Respond
All
on the
right.
chat box.
Yes, I do
You
have
you
received, but
typed something?
that is
Let's see. Maybe just as you could help me with the chat and the participants, because when I'm sharing the screen, I'm not able to go.
Yeah, true. Some members have put their feedback on the chat indeed. Others have received such and others have not. So obviously, depending on someone's location and maybe the kind of services they go for and the digitalization structure in their countries, yeah, we have mixed answers.
Okay, thank you, Justus. Maybe we could hear from Hanat. Hanat, what was your experience? Or anyone, whoever has received an SMS reminder, you could feel free and share with us. Just 1 minute or less.
Yes, hello. This is Maha. I have received previously SMSs for health services during the COVID. Actually, the Ministry of Health used to send SMSs about the vaccination. So like go get vaccinated, or this is the time of the vaccine shot you requested, and this is the time of the second shot, and stuff like this. I think this qualifies as SMSs for health services, right?
Right. Thank you so much for that experience. Thank you for sharing with us. So even a simple digital tool like an SMS reminder can make a difference in our lives. So just like our colleague has shared her experience, but how do we know it's really working? Maybe who is benefiting and how can this be improved? That's exactly what M&E in Digital Health helps us to answer. So in this workshop, we are going to discuss more in details what is digital health. Then we embed it with the M&E framework. All right. In this workshop, we are going to understand the M&E frameworks for digital health. We're going to identify the inputs, outputs, outcomes, and impacts. We are going to be able to select appropriate indicators, and this then also introduce logic models and a theory of change. According to you, what do you understand by the term digital health? Just a simple explanation. Just as you could help me with that chat.
Yes, members can give their quick. How can you summarize that? I believe that is even a recap from the first session. So any members who can summarize for us what digital health is, even at this time. Yeah, so Nelson mentions utilization of ICT to facilitate health procedures. And I think procedures here can be even more wide. Any work in health, the use of technology to improve health care, that's an yes. The use of digital tools to improve health outcomes, sure. So digital is where you use the computer or internet to support health or health care. Yes, that's one of the tools. The computer or internet are just some of the technologies. Any digital tools, yeah, basically use of information technology to improve health outcomes. So most of the members really are summarizing it well.
That's perfect. That's perfect. Okay. I will not differ from them so much. With digital health, we refer to the use of digital technologies to support health services. We are supporting health systems and health decision making. So when we look at the examples here on the screen, we have the electronic medical records, we have the DHIS2, we have the mHealth, telemedicine, digital surveillance systems. I will not go so much in details, but these are some of the examples of digital health. But key to note is these examples that have been cited are for Uganda. Can we have someone maybe from Tanzania or Kenya to cite us some examples? Anyone? Or maybe a different country, whoever is present, please feel free. Use the chat or unmute and talk.
Godwin mentions what you displayed is almost same as what they use in Zambia.
Thank you, Godwin. Thank you. All right, so these examples may look different, but they all have one thing in common. Yes, they are different. They are meant to improve how health services are delivered and used. But to understand whether these changes are happening, we need a structured way to measure results, which is an M&E framework. So this introduces us to a core thing that we are going to discuss this evening, which is the M&E framework. Yes, the M&E framework. In other words, what are we monitoring? What is that? What is an M&E framework? Anyone who is willing to give a short answer? Anyone before I chip in? Okay, so in simple terms, an M&E framework is like it's a roadmap. Maybe I'll give you an example. When you're going to work, what resources do you need? We are now trying to use the real life examples. If you wake up in the morning and you're going to work, can you give me some examples of resources that you need to be able to get to work? Please post in the chat or unmute and talk. These resources could be financial, could be materialistic. Anyone?
Material resources, we need a car, a vehicle.
You need a car. Okay, thank you so much. I didn't get the name.
My name is Otobong from Nigeria.
Wow, thank you, Otobong. You need a car. Okay, any other? Okay, maybe you can go with that.
Yeah, members have even mentioned more items.
Okay, okay,
As you
okay.
prepare, you need maybe the packed lunch.
Lunch,
You need the mobile
nice.
device.
Mobile device, perfect.
Yeah, some money and
All
related.
right. Wow, wow, wow. Okay. So as you get to work, while at work, what activities do you do, or what activities do you conduct when you're at work? Any activity that you engage in?
It depends. It depends. You could be executing, you could be learning, you could be training. It depends
Okay,
on what
training.
services you render at work.
Let's maybe, okay, you've already said training, that's already an activity. What about as you're implementing or executing, which activities do you normally do?
You plan by having a
plan.
to-do list.
Okay, you have a to-do list. That's planning. Any other? Sorry?
Members have put in the chat items like meetings
Okay, meetings.
with colleagues.
Okay. All right.
Some communication, writing reports.
Writing reports. All right. That's awesome. So
Examples.
what results do you produce while at work? The results. These are actions that are coming from the activities you've conducted. Did you get me? What results do you produce as you're carrying out your activities? Remember, we started from home. You got the resources, you went to work, you conducted activities. Among the activities that you cited, you talked about meetings, trainings. Then what are the results? What comes from those trainings? What comes from those meetings?
I don't know if I can quickly chip in.
Yes, Mohammed.
The results can be two-way for me. Maybe a number of meetings you've conducted, number of reports you've written, number of it may be budget you have prepared. And the other way to it is what were the outcomes from those meetings? What were the basically outcomes? What were the reports saying? And also what were the implementation roadmap for those budgets that were approved?
Okay, thank you so much, Mohammed. So you're not really far. You're not far from what I'm trying to say. We started with the resources, we came in with the activities, we've talked about the results. And now would want to talk about the changes. This could be long-term and the impact that we expect. So if you come in at work maybe and you train staff, maybe train them on using digital technology, which impact do you expect at the end of it all? As you train, what do you expect? Anyone? There is no right or wrong answer.
A change and
Okay.
adaptation of the participants in the usage of the technology.
Wow. Thank you so much. We expect that change and adaptation. Thank you for citing that. Well, with the M&E framework, we basically, it's a roadmap, as I said. We are coming from resources. You're coming like, what are you inputting? At the start, you're looking at the inputs. These are the resources. From the resources, you would want to see, to conduct activities. We mentioned the trainings. What do we get? What would be the outcomes of that? In the long, so you'll find that the framework is a tool, it's a logical flow of a project. How resources are turned into actions, then those actions are turned into results, and the results are turning into change. So without a framework, we may collect a lot of data but fail to answer the question. Maybe is the digital health intervention working? Case in point, we are looking at digital health. If we are implementing digital health, we would want to ask ourselves, is this intervention working? So as the slide shows, it's a logical flow. Let's see how the roadmap is put together. This is exactly what we've been discussing of the M&E framework. We began with the resources. Our roadmap begins with resources. We are looking and with injecting in to start to ensure that the intervention is implemented. These resources can be materialistic, they could be programmatic inputs, it could be policies, it could be financial, it could be technology. So our inputs, this is the first component of an M&E framework. And as you can see on the screen, we've shared tablets. A case of digital health intervention, we have the tablets, we have the phones and computers. Then we would appreciate the internet connectivity, because without the internet, we may not be able to share data. And if it's not shared, then it's not going to help us in decision making, to make health decision making. Would want the softwares. So you find that the various softwares that can be used, you could come up with applications like Kobo, Diversity, or we can use ComCare. So they're not limited, but they are different softwares that you can use depending on what you want to implement. So with the input, we also have the trained health workers. Those are the personnels. And then we have funding. Of course, we may not be able to implement without funding. So all these are resources that are put in to ensure that the intervention works. Remember, we are on our way to work or to implementing a digital health intervention. Do you have any question there? All right, so we mentioned that when we reach work, what activities do we conduct to ensure that we deliver? So these are activities that are undertaken in the delivery of intervention, the processes or the activities, something that we do in delivery of the digital health intervention, any health intervention. So we gave examples of training courses. We talked about training. Yes, there is partnership meeting. We can conduct meetings while there. Activities that are required to test and update the digital health system, something to test it to ensure that it's working. Would do some monitoring and support supervision. And other activities, they're not limited to this, depending on the kind of work that you're doing. You could be maybe treating, you're doing clerking, It's actually not limited to this. It's more than anything you do. Any activity that you do at work, you'd want to list it here, because now you have left home and you are at your workplace. You would want to do something to change people's lives. So the next component that we are looking at is the other outputs. And we agreed these are the results of our actions. If we train people, or if we undertake training courses, what would be our deliverables? If we participate in meetings, as discussed earlier on, what would be our outputs? So the outputs, you find that they are direct products or services of processes or activities in an intervention. As a result, you'll find that service delivery improves. It means if health workers can reach more patients and do more follow-up, health services can become more available and of better quality. The services become better and they're coordinated. This is what exactly that we discussed, that as you are there, what exactly are you? You are treating as an activity. So when you come to an output, how are we going to measure that? Which deliverable are you going to give us? If you treated patients, we would want to know how many patients did you treat? If you were following up patients, maybe you're doing teleconsultations and all that, how many have you followed up? That is an output. And an output, as earlier mentioned, it is either a service or a product. So looking at what we've shared here, we have health workers using digital tools correctly. So if we talked about training them on using digital tools, an output of that training is they are using the digital tools correctly. If we are training them on digital health, we would want to know how many staff or how many health workers were trained on digital health. If we train them on how to use DHIS, how many facilities are reporting digital health, are using our digital reports, because we are working on a digital intervention. And then we would also want to know how many, if we have a software installed or an application, we would want to know how many facilities probably are reporting, have a report generated electronically. So in our roadmap, the third component is an output. And in short, an output, we are looking at the products or the services. We'd want to also look at the fourth component, an outcome. Remember, we left home, we went to work, we conducted training, we did some treatment, we undertook courses and all that. We got outputs, we got some products, we got some services, but we would want to know an outcome. In short, an outcome is a change. What comes in as a change? If you have implemented, what are the changes that you're seeing? Most of the cases, the changes are behavioral changes. They could be perceptions, changes in perceptions or attitudes. So an outcome is you're looking at a change that has come as a result of your intervention. So when we look at outcomes, we can assess them at 3 levels. We can look at it from the angle of the health systems level. Digital health can lead to more efficient use of resources. With digital health, you're using phones, you're using tablets, so it means that you're going to be efficient as you're using the time. You're looking at the staff, the number of staff you're going to use in that intervention, as well as the money. So from the angle of the health system level, you're going to be efficient. You'll find that health services are responding better to clients. More people are being reached with essential services. We have another angle of the providers, the health providers. You find that the health workers, the digital tools can help them increase. They can increase their knowledge and skills. So they use they'll find that health workers are using their time more efficiently, they improve the quality of care provided to the patients. And then at the client level, that's the patient level, with digital health, it can result into a better understanding of their health and treatment faster and easier. So we have an element of time. There is efficiency in actual resources, because time is also a resource. So as we look at our digital health intervention, at the outcome level, we are looking at improved data completeness. If we are looking at maternal health, that you find that as you're using the digital tools, data is going to be improved. It's actually going to be complete. You're going to find reduced reporting delays and increased use of digital records, because data is easily available, as it's easy to upload the data, do the reporting or the analysis, which would aid in decision making. So in short, the outcomes, we are looking at the behavior changes as a result of our intervention. Then we'd want to look at the last component, which is the impact. As we are monitoring throughout our project, our digital health intervention. We are monitoring our inputs. That was the first component. We are monitoring our activities. We are monitoring our outputs. And now we want to monitor at the impact level. With monitoring, it's throughout the project, the intervention. So impact refers to a long-term change that happens as a result of health intervention. This impact can be positive or negative. So as we design interventions, of course, we are looking at the positive part of it, but you would also want to look at the negative part of it, such that you're able to mitigate these risks that are likely to come out as a result of a project. So the impact we are looking at, we can still measure it in 3 ways: looking at the health system performance provider, the time spent on the patient care. With digital, we are not using papers, it's more of technology, so data is entered right away. When we look at the population view from that lens, you have reduced illness or morbidity. From the broader perspective, you have reduced out-of-pocket costs, as people are able to appreciate using the digital tools. So looking at this screen would have improved quality of care. If we are designing an intervention about maybe maternal health, you would expect improved quality of care, better disease surveillance, and improved health outcomes. This screen is taking us to an M&E framework, the roadmap that we've been discussing in short. So now that we know what we want to monitor, the next question is, how do we measure it? We've seen the monitoring at different levels. Those are the components. So now the question is, how do we measure what we monitor? This takes us to the M&E framework. Just a moment. Wow, perfect. Can you see my screen?
Yes.
Yes,
can
we
see.
can.
All right, so this is a summary of what we've been discussing. It's called an M&E framework, a case in point for maternal health. It's a digital health intervention. So in this first column, we have the intervention logic we have highlighted. We have the indicators, we have the data sources, then we have the assumptions. So we have the inputs
Sorry,
here.
we can't see the Excel.
Oh. Let me stop sharing and I share it again and see. Can you see it?
Yes, it's much better now. We can see it.
Thank you. All right, so this is a summary of what you've been discussing. This first column, like I said, we have the intervention logic, we have our indicators, we have the data sources, and then the assumption. As discussed, these are the inputs. When we reflect on the first example of going to work, something that you're going to put in, you're going to inject in, we are looking at the resources, the different resources. We have the tablets, we have the smartphones, we have the systems, training materials, the funding, of course, the health workers, etc., etc. So the inputs, as earlier on discussed, these are the resources that we put in to ensure that we conduct our intervention. As we go like this in this column, we'd want to look at the indicators. At the indicator level, you'd want to measure. As you're doing your monitoring, you're going to be guided by the indicators. If we are looking at tablets or smartphones, how many tablets have we distributed? Remember, we are working with a digital health intervention. How many tablets? Without these tablets, we may not be able to do the reporting, to upload, to collect data or upload any reports. Number of health workers trained, would want to look at the budget allocated for the project. The data sources, this is more like a means of verification. What is actually going to show that these items or these resources were injected into the project, into our intervention. So we are going to look at the procurement records. A case in point, if we are buying tablets for our maternal health project, would want to know how many tablets did we buy. If we train staff on how to use the digital tools, we may want to look at the attendance sheets, the training attendance sheets. We would also be interested in looking at the financial reports versus our inputs. And of course, in our framework, we would want to look at the assumptions or the risks. So for us to be able to implement this intervention, we need to be having a sufficient budget. It has to be available. Without it, we may not be able to proceed. We are looking at the assumption that staff are willing to use digital tools. It's one thing having digital tools, and then it's another where staff are not willing. Maybe they're preferring papers or something. Then we also assume for our project to take place, our devices, they remain functional. So another component that you're looking at are the activities. This is when you reach work. We are looking at training workers on digital health, on digital, maybe ANC tracking. We are looking at implementing the EMR or the DHIS too, data entry, would want to train. Then conducting maybe an outreach via SMS reminders, supervision, and mentoring of health workers. With the indicator level, we'd want to look at the number of trainings conducted. We'd want to look at the percentage of health facilities reporting and the number of SMS reminders. So you'll find that each level, we began with the inputs. We have the indicators, you have the means of verification, then the assumption. The second component are the activities. We've looked at them, the means of verification. If you're looking at trainings, you conducted trainings, we'd want to see the training reports. So those of us who do the trainings who conduct trainings without writing the training reports, this comes in handy for us, because without these reports, we may not be able to make decisions. Then we'd want to look at the DHIS logs or the SMS system logs. So as we are using these systems, we have to be able to log in. So the number of logins or usernames shared would also help in tracking health workers who are using the system. So of course, on an assumption that health workers attend and engage the trainings, because we are working with digital tools or on a digital intervention, we would want to assume we have reliable internet network, and we are also assuming Our project for pregnant women, they have mobile phones. They can be reached via SMS. We also have another level for outputs. That's our third component. Outputs, we agreed as you reach your workplace, you've done the trainings. What is that action that is as a result of your activities? We have health workers, they're using the dictator tools. If you train them, you expect them to use it, or to use the tools. You want to see ANC antenatal care registers that are updated digitally. We are going away, we are moving from paper to digital. We would want to see the monthly digital reports. Would also be interested in seeing the pregnant women receiving reminders on their phones. At the indicator level, we'll come in to see the percentages of maybe at a facility level, how many are submitting timely reports, the percentage of pregnant women enrolled in SMS reminders, maybe also the number of ANC visits recorded digitally. Our means of verification or data source, something that is going to verify that these were conducted or this has been measured. We are looking at the SMS delivery logs, facility registers, the EMR reports, etc. Of course, we want to assume that staff are continuing to enter data, because without this data, we are not going to be able to measure. We are going to look at the pregnant women receiving pregnant women respond to SMS reminders and the devices if they're working. At the output level, we'd want to see the change. This change, it could be behavior, it could be an attitude or perception. We are measuring the change as a result of our intervention. We'd want to see maybe percentage of people completing ANC records as they're being reported, maybe in the health sector performance report or any report. Would want to see facilities reporting. Would also want to be interested in seeing the average time per facility. Would want to see the increase in the ANC visits and the number of decisions made basing on the systems. With the data sources, would have the health management reports, the supervision reports, and the assumptions. Health workers are consistently entering data, accurate data. But the keyword here is accurate. Would want to see the facility management acts on the data, and then the pregnant women follow up. The long term of it, this is our goal on this maternal intervention. We want to see a reduced maternal mortality and morbidity. It is at the longer term, as we've implemented. We are interested in seeing improved maternal and newborn health outcomes. We are interested in seeing strengthened health system decision making. And how are we going to measure it? We are going to look at the maternal mortality ratios, the neonatal mortality rates, the percentage of skilled birth at the skilled birth, the percentage of births attended by skilled personnel. Of course, as we measure this, these are going to be reflected in our health facility reports, in our national health surveys, in the HIMIS reports, health management information system reports, or maybe the health sector performance reports, and any other reports that are combined by the Ministry of Health. So in short, that is our M&E framework. As we are implementing, we need to be reminded that we capture this data accurately and consistently, because these are really key in making decisions. So I would want us to ask, now that we know what we want to monitor, the next question was, how do we measure it? And the answer is, we are measuring it using the M&E framework, and thus that gives birth to the indicators. Just a moment. Maybe I should ask us, what is an indicator? What is an indicator? Justus, kindly check out in the chat. In simple terms, what is an indicator?
Nothing yet in the
There's
chat.
no
Or someone unmute.
Yeah, one member says a variable.
It's a variable. Thank you.
Variables that
That
show question.
Justus, I can't hear you.
Yeah, members mentioned about they relate indicators with variables.
Like variables.
Okay.
Okay.
Can you hear me?
Yes. Yes.
Okay, for me, I would say an indicator is a variable, an element that shows the state of something, like how far we've gone, where we are.
Wow. That's awesome. An indicator is a sign of progress or a change. It can be qualitative or quantitative. So an
Elizabeth,
indicator,
in case you are sharing
the screen, not
PowerPoint,
yet.
not here.
Ah, sorry. Let me stop sharing. Can you see it?
No, it's still the Excel sheet that is showing.
How about now?
Yes, it's a lot better now.
Yes.
All right. So an indicator is a sign of progress or a change that can be qualitative or quantitative in simple terms. An indicator provides a simple and reliable means to measure an achievement. As you are at work, maybe you're treating a patient. What are you going to use to show that the patient is responding to the treatment? You may want to look at the different indicators. Yes, anyone?
Yeah, maybe like the blood pressure, the
The what?
temperature.
Okay.
You want to look at the progression of the, like, if it's the patient was previously having like high fever, you want to check out the, you want to look at the temperature. Is it dropping?
Okay.
And then you want to check out
Right.
also like the blood sugar, such measures. These are like
All right.
mostly quantitative.
All right. Thank you so much. So according to World Health Organization, it's a variable that provides a simple and reliable means to measure an achievement, to reflect the changes connected to an intervention, or to help assess the performance of a development actor. Or in short, we want to measure the progress or a change as a result of our intervention. So these indicators can be qualitative or quantitative, as we are going to look at them in details. Qualitative, you're looking at maybe an example is maybe availability, or you're looking at the availability. You may want to, it's not really quantified because with qualitative, you're basically looking at a description. But with quantitative, you're expressing it into figures, numbers, or percentages. So key to note is any intervention should have at least one measurable indicator with not more than, let's take 3. I think 10 is way too much. 3 to avoid the confusion, to be on the right track. If the indicators are also many, it may be hard for us to come and do the accurate reporting. But if you have 3 is a bit, at least, manageable. So this, what you're seeing here, these are good indicators. The underlying word is good. They're smart. Smart as in smart, the word you see, S-M-A-R-T, smart. So as we are developing indicators, these indicators need to be smart, specific, measurable, attainable, realistic, and time-bound. What do I mean by specific? They need to be clear. You are clear on what you're going to measure. A case in point, you'd want to see reduced maternal mortality. You are indicating exactly what you want to reduce. When you talk about a measurable, something that can be counted or calculated. When you look at attainable, you're looking at something that is realistic and available within the resources. Many of us set indicators that are not realistic, and you find that when the project comes to an end, something you haven't achieved that. Why? Because you didn't set something that is attainable within the available resources. Remember, we are being guided by our budget. We are looking at a component relevance, something, an indicator has to be useful for decision makings. We don't randomly select indicators, but we are being guided by our objective, the objective of the digital health intervention. Are we looking at increased skilled birth attendance? Are we looking at hospital deliveries? Are we looking at reducing maternal mortality? It has to be relevant. So you find as we are setting these indicators, we are usually guided by goals. It could be the Sustainable Development Goals. We are guided by the global goals. So it has to be, as you're setting an indicator, it has to be relevant to the kind of work that is useful for at the national level or a global level. Then the last one, T is time bound. It should have a clear time frame. As we set our indicators, we need to know when we want to achieve them. So you have to set maybe by 20, a case in point, when you look at the Sustainable Development Goals, you'd want to, or the 2030 agenda, you'd want to see maybe by 2030, how you'd want to see the maternal mortality ratio reduced by that time. You'd want to have an increase in skilled health facility deliveries probably by 2030, depending on what you want to set. So in simple terms, a good indicator should be able to answer these five. Are they five? Yes, these 5 letters. How are we going to be guided as we're selecting these indicators? We are going to be guided. There is no do or die. We are not nailing ourselves, but we are just being guided by some existing guidelines. As we are selecting our indicators, they should be in close alignment with our digital health intervention. Remember, we are doing digital health. Our indicators should be in line with the digital health intervention. They should be practical with practical considerations. The indicators must be linked to what the project aims to do. What is that project aiming to do? Reaching people, reaching out to people. Is it with a community health sensitization? Exactly what you want to do. The indicators should be in line with what you want to do or the purpose of the project. And of course, the kinds of decisions need to be made based on the data. The examples of the indicators by 2026, at least 90% of the health facilities will have at least one health worker trained and certified to use the DHIS2 maternal health module. These are 2 examples. When you look at these examples, they have the SMART criteria: specific, measurable, attainable, relevant, and time-bound. When we look at the first example, maybe let's unpack what the SMART criteria entails. What is specific in the first example? Chat, and just as kindly help me with the chat, or one may feel free to unmute. What is specific in this indicator?
At least 90%
Okay, I'm
of
seeing in the chat box, someone said the date. The date is specific, June 2026.
It's awesome.
And another comment said time.
Time.
The target is also specific.
The target. Okay. So we've
Yeah, you
seen
said
that
at least
time.
90%.
The target. What's the target?
You said at least 90% of health
facilities. Yeah.
All right. What is relevant?
What is relevant? I mean, 90% will have at least one health worker trained.
would want to see at least one health worker trained and certified to use the DHIS.
Yes.
We talked about specific, measurable, attainable, realistic, and time-bound. Perfect. What about the second example? What is specific?
The target is specific. At least you said 95% of project-supported facilities will have at least one functional tablet. That's very specific with internet connectivity.
Wow. Measurable?
95%.
95% of the supported facilities.
Do you think this is attainable? Is this attainable?
So it depends on where we are coming from.
I think it's very much
Depends
attainable.
on the based on the baseline data. If those were all about 80%, then that could be. But in case of that, if it was all about 60 or 30%, then we can achieve that by the 2026 June. That might be.
So, for me, I would ask if.
Sorry, please, if you'd like to make a contribution, please, so that there will be some order, can you just show your hands and you'll be allowed to speak so that it doesn't get very crowded? All right.
Okay.
So who is speaking currently?
Okay. Maybe we have a hand raised. Probably could hear from one before we continue.
Izuchukwu Basil can speak. Yes.
Okay, thank you. So I was going to ask if point 1 is related to point 2 in terms of answering her question of attainability. Are they related?
No, they're not. They're just random indicators.
They're just random indicators. So
yeah.
I would say, so I would say point 2 is attainable because you said at the end of quarter 2, and you were very specific with what you want. 95% of project-supported facilities will have at least just one functional tablet with internet connectivity. It's very, very possible. It's attainable.
Okay. Thank you so much. I think we are all on track. So as we are setting our indicators, let us use this criteria, which is SMART. As you sit down in the meetings, as you sit down on the different projects, please use this SMART criteria because it's going to help you. You're going to appreciate it at the end of it all when you're doing your measurements, when you're measuring the changes or the progress of your intervention. Maybe would want to look at the common indicator mistakes. When selecting indicators, let's avoid indicators that are just that are too many, indicators that are vague, that are ambiguous. If we avoid this, then we are basically looking at the SMART criteria, because with the SMART criteria, you're going to be specific. You're going to be measurable, attainable, realistic, and of course, time-bound. So we've looked at the indicators, we've seen how to select them, but to understand what they mean, we must place them inside the logic model. And a logic model is actually what we do. A logic model usually is presented as a flow diagram or something that is narrative, but this is it's like a chain, something to do with a visual map. We are linking the different components that we have in our logic model. Don't confuse the logic model with the M&E framework. The framework is what we are monitoring at the different levels, but with the logic model, we are looking at what we do. So the indicators show what is happening in this logic model. We have the inputs, the activities, the outputs, outcomes, and the impact. It often shows the relationship between these interlinking components. It's so plain as you see and easy to understand for the different health workers. An example of a logic model that I could bring in would be training health workers. on digital tools. If we train them on digital tools, we're having better use of data and improved service delivery at the end. We would want to have a look at the logic model. This is a table in a table format. Maybe I would want to hear from you. Which components are you seeing that are cross-cutting with the M&E framework? Which components?
Does anyone have a response to that? You can comment in the chat box, or you can just show your hands.
We've discussed the M&E framework. We looked at the different components. You remember our example of waking up and going to work? We looked at the different components. Anything in the chart?
Yes, there's a response in the chat box. Someone said outputs.
Outputs. That's great. Another
comment said inputs, activities, outputs, outcome, and impact.
That's perfect. So a logic model is simply presented like this. We have the inputs, we have the activities, we have the output, outcome, and impact. Very simple and easy to understand. With our digital health intervention, we are looking at the phones, tablets, funding. We can have the internet software applications, the train health workers, all those are inputs. The activities, we are going to train staff on how to use these. We are going to deploy and install devices. We are going to enter patient data. So when you have the tablets, you're going to train staff, the health workers on how to use them. We are going to deploy and install the applications in the health facilities. We are going to be able to enter the patient data. All those are activities. From the activities, what do we expect? If we've trained staff, we'd want to see, okay, how many staff have been trained on our digital health intervention? We put the number, maybe 20 staff. We'd want to see an output. If you deploy devices or you install the application, maybe in the health facility, what is the output of that activity? Would want to see routine reports generated automatically. You log into the system and generate that report automatically. If you enter this data into the system, what would be the action, the output of that? It means you would want to see the percentage of health workers submitting the reports electronically. At the outcome, remember you're looking at the behavior changes. We are looking, if we train staff, you're using tablets, you're moving away from paper records and all that. It means we are going to have faster service delivery because you're going to enter data there and then. You will not have to keep it and wait for the end of the month and do the data entry, cleaning, or the reporting. No, it's there and then. An outcome of deploying, you want to see increased use of data for clinical and management decisions. As you make these reports, you expect at the management level, what are they using this data for? If you have this data, if people are reporting, submitting the reports electronically, you have an outcome, increase in ANC attendance, health workers using data for decision making. Then in the long run of our intervention, the end of it all, our goal is to have an improved health outcome, improved quality of maternal and newborn care, or improved maternal mortality ratio. These are the same components, but they're not in a table form. We can look at the funding, we can look at the mobile application, we can look at the tablets, we can look at the activities. Maybe let me pause here. Can we have maybe 2 people to share with us activities they do while at work in line with health, digital health? In other words, what the project does, what do you do at work? What do you conduct? What do you do as an activity?
Okay, can I talk?
Yes, Nelson.
Okay, so recently we trained community health workers on how to use the DH2 platform to impute the blood pressure readings, as well as outcomes from qualitative data on diabetes for patients that initially before now we've been doing stuffs manually. So for activities, what we've been doing for some time now, we've been going to primary healthcare centers, interacting with the community health care workers, and also training them on how to, put these data on digital platforms.
Thank you, Nelson. That's a great example of an activity. You're training them. So the key word here is training, something that you are conducting. You're training them as an activity. From the activity, we have the outputs. Here, I would want to look at the different levels. You want to see the numbers. You want to see what is coming, which action is coming as a result of your activities, a case in point in training. Then the outcomes, you're interested in seeing people using data for clinical and management decisions. We are interested in seeing completeness. When data is not complete, it makes it hard for decision making. So with M&E, data has to be accurate, it has to be complete, it has to be consistent. Our last is the impact at the goal level. We are reporting improved quality of care, because that is what we'd want to see at the end of our intervention. We are reporting reduced deaths on strengthened health system. I think at this point, I would take you to the last concept we want to discuss today is the theory of change. So far, we have shown what we will do. That is the logic model. So these activities don't automatically lead to better health outcome. Something must explain why it will work, why they will work. So now let us explain why we believe this will work. And that is what we call a theory of change. We are not going to only have a logic model of what we are going to do. No, we have to back it up with why we believe it's going to work. And that is the genesis of the theory of change. It is a model that shows various pathways of change. It explains how and why the actions we take today are expected to lead to a better health in future. In short, our theory of change is the explanation of why the route will get us to our destination. So if we have chosen a given route, why is it going to take us there? So it's not just what we do, it explains why we believe it will work. So from the slide above, what problem are we solving? What are we trying to solve? Someone unmute.
We are trying to solve the issue of maternal death by improving attendance to antenatal care through digital health implementation.
Thank you. What are we doing differently?
Now, what we're doing differently is that we are trying to bring in digital devices to aid with antenatal visits. And then one of the things we're doing differently is that we have to look at, obviously, before getting to this point, we've done our groundwork to see reasons why there have been no frequent attendance visits from these women. And most of the fact might be because people in the rural community don't really understand, or sometimes they can tell you they forget. So when we start sending SMSs to their phones, reaching out to them digitally, we are doing things differently. We are making them remember. We are putting a reminder in their head that, okay, yeah, you should know that at so and so time you should be at the healthcare facility for antenatal visits. And then we know that it's when these visits are made, that's when maternal, how will I even put it, issues that bring about death will be attended to, and then we'll see improve in health outcomes, basically.
Thank you, Nelson. Thank you. So when we look at this, just the way Nelson has been stating it, we want to do things differently. We are going digital. We would want to do some follow-ups. We are sending SMSs. We are using systems to log in and all that. So when we have our theory of change, what changes do we expect to see? What do we want to see in people? If we are sending SMS reminders for these pregnant women, which change do we expect to see? More ANC attendance. As they get these messages, you remind them on their next maybe appointment or checkup. And in the end of it all, you have better data. You have full attendance. Then what must be true for this to work? Phones, we are assuming, these are assumptions. We are assuming that the phones that we have, they are working with the tablets, then staff are using the system. Maybe I should pose a question. What could break the chain? If we do all these, what do you think will break the chain? Anyone? What would break the chain? We are basically looking at what if we go digital, we train them and all that. We've done our best to do everything. What do you think is going to limit us if we don't? What do you think is going to fail us? In other words, the risks. We are assuming that phones work. Staff use the system. They appreciate the technology. You know, sometimes we bring new systems, but then staff resist that technology. So they resist that change that is coming up in the reporting. That is, we come up with our intervention and assume staff are willing to be trained and use that project. On the other hand, there are some risks that would want to look at and maybe probably be able to mitigate them. Those are the things that I'm looking at. What could break that chain? We are looking at the network issues. If we have phones, then the network. It's one thing having a phone and another having a network, being connected to network.
Yeah,
We are
so
assuming that the workload is also is actually manageable for staff, as the health workers are doing their treatment and all that. They are also able to enter that data timely. The keyword is timely, because we need this data in time to be able to make decisions, informed decisions. So with that, we are able, that's how we understand the assumption. We are able to understand the different assumptions. The theory of change tells us what we are going to do and why we think it's going to do. As we are coming up, designing our projects, we are looking at what is going to work. At the back of your mind, remember, what are you going to do differently such that it works? What are the changes you expect to see, and what must be true for this to work? If you are designing a digital health intervention, please don't forget technology. Technological inputs. Don't forget the risks and assumptions that come with technology. Many people resist technology, but at the end of it all, after they've learned it, they appreciate because it's really efficient. So you look at it in two ways, in two angles. What must be true for this to work, and what could break the chain? When you answer that, you wrap it up with a good theory of change. I think this is what we've explained. A theory of change explains how and why what we are doing will lead us to better health outcomes. So in this project, if we train health workers and use digital tools to track the pregnant women, and if these women receive timely reminders, then more women will attend ANC and deliver health facilities. This should lead to healthier mothers and babies. This is our goal. It works only if the phones, we are assuming that the phones are working. We have internet, and of course, people at the center, at the center of it, at the heart, are the health workers. They are consistently using the system. So if our dear health workers are not using the system, we may not be able to do timely reporting, consistent, accurate reporting, and at the end of it all, we may not be able to measure. We may not be able to know how many deaths are occurring. We may not be able to measure the number of pregnant women attending ANC and how many have attended at least 4 times. We may not be able to measure that. So with this, as we are working there, let's appreciate the use of technology and data in M&E. We have the logic and versus the theory of change. This is a brief summary. The logic model, it is what we do. It has the steps, outputs and outcomes. It is that chain that is followed on what we are going to do. The theory of change, it has why it works. It has the logic model and why it works. It has the reasoning, it has the assumptions, and the risks. So the logic model is just a structure, but the theory of change is the explanation behind it. It shows what is going to happen. A theory is going to explain why and how the change happens, including the assumptions and the context. So the key takeaways here, we have the digital health and M&E focuses on use and impact, indicators must inform action, logic models and the theory of change support good design. At this point, I would want to invite some questions. Thank you so much for listening.
Wow, thank you so much for that amazing delivery. I'm sure we've all learned a lot throughout this process. I can see Avdal is saying thank you, and we have a couple of questions now. I would like to open the floor to Mohammed Kabir. Your hand is raised up. Yes, you can ask your question.
Yes, thank you very, very much for that wonderful presentation. So I think my question is a bit straightforward. At what point, seeing the logic model and also the TOC, the theory of change. So for a particular project or for a particular program, at what point are you going to make that decision to say, okay, I'm supposed to deploy logic model in designing this particular program, or I'm supposed to use theory of change? What kind of informed that decision at that point of program design?
Thank you. Thank you so much. I would want to say that M&E runs right away at the program design. In fact, at the initiation, the moment you have that idea, you conceive the idea of a project, M&E has to come in. And with M&E, we are looking at, it is throughout. I will not tell you at the planning, no. I will not tell you at the design stage, no. At the closer, no. I would say M&E runs throughout the project. So as you are planning, you have to plan that you're looking at the theory of change, because you would want to know why this intervention is going to work. But there is this time, which is the as you are designing, you're designing your project, you're dealing with the different programs, you're having new ideas and all that. You're looking for the relationships that if I do this, what is going to happen, the cause and effect relationship. So at the design stage, the program design, you have to embed in your theory of change, because you have various pathways. You know, it's like a vehicle, you're headed somewhere, but then you're like, what if this happens? You're looking at the assumptions. Okay, if we come up with this digital health intervention, we are sending SMS, maybe an SMS blast or reminders. We are assuming that the pregnant women have mobile phones. Otherwise, if they don't have mobile phones, then our project may not work out. We may not achieve what we want. So at the design stage, we have to look at the theory of change, because we want to be guided with the different explanations of why something is going to happen or why we are taking that pathway. At the logic model, we may want to look at it at the planning stage, the implementation, and the reporting stage, because we have indicators. We are looking at the indicators. We are looking at the outputs. We are looking at we want to measure so many things along the way. I hope I've explained to you that is Is it clear?
Yeah, so Muhammad said it's responded showing it's very clear. I would like to
All
read
right.
a question from the chat box from
Okay.
Favor. Favor asks about drafting an indicator. How do you come about the percentage? Is it random or research based?
Thank you so much. Drafting an indicator is not random. You find that as you're designing a project, there are similar projects that have come up or that have been implemented. So you may want to read or get more details about what they've been implementing, especially if the project is not new. You'd want to find out how the current status or progress of what you're working on. Let me say we're looking at health facility deliveries, or we are sensitizing, such that we increase the number of people having health facility deliveries. You'll find that there is already existing study, research, or projects that have been carried out in line with that, and there are numbers, or there's a percentage in your project. You're going to adopt it as a baseline because it's already existing. If it is not existing, then you're going to conduct a baseline survey and find out how many women deliver in a health facility. That is going to give you a baseline on which you're going to be able to benchmark and implement. After implementing, along the way, you come in to measure. Okay, I found the percentage at 20% in this district. After our intervention, maybe after a year or how long you're implementing it, you're coming in to measure. So from 20% to, let me say, due to the sensitization and all that, you've increased it to 50%. So it shows with the M&E, you have benchmarked on 20 and you've increased up to 50. So it shows there is that usual baseline, either baseline survey, or you're getting it from existing projects, or we are using proxy indicators. I hope that answers your question.
Yes,
Hello?
thank you. Thank you so much. I'm trying to check the chat box. Yes, she already responded. Yes, you answered the question. I'm trying to see if there are any more questions in the chat box. There's still room for one more question. Does anyone have any question from this session?
I think we can check the YouTube as well. Some questions were dropped there.
All right.
So I think there's a question from YouTube asking what methodology should be used to measure the second month percentage, given a baseline value of 70%. I think that was, yeah, that was earlier during the presentation. Elizabeth, did you get that? You're mute if you're speaking.
Sorry, I was on mute. I didn't get you.
So there was a question. Let me just share my tab. I hope you can see my screen. So from YouTube, we have participants on YouTube as well that are currently watching. There is the question that what methodology should be used to measure the second month percentage, given a baseline value of 70%. I think that was earlier in your presentation.
Which percentage? Used to measure the second month. Okay. Yes, Justus.
Yeah, so I think the participant is trying to get a random example where maybe they are implementing an intervention and this month they have achieved some number, or they have conducted the baseline and they have a specific level of achievement. So they are wondering, what then do we put as our target to the next month's achievements? Yeah, it
Does
can
it
be
ma-
generally, how do we generally come to put a target for the next period, given achievements or baseline for this period or a previous period?
just as, does it mean that you've already achieved the target or something?
Yeah, I pick it that
Because if we have
maybe
the
a target for
baseline,
this period is achieved, or even a baseline for for the previous period, and trying to set target for the next periods. Generally, he's trying to look at the next periods. How do we set targets for those next periods?
all right. How do we set a target for the next period? We are assuming that we have our baseline and we've implemented, and then we've achieved our target, right? So we'd want to know to achieve to measure, is it for the next period? Am I
Yeah,
on
set
mute?
a target for the next period, maybe before
Okay.
implementation.
Okay, so we usually look at results from the previous periods. How have you, how did you achieve what has been working? So the results from the previous periods usually guide you to give a baseline for your next, where are you standing, what has been done. Usually you use it to benchmark still for your next. You can also look at the rate of improvement. So the next stage, you find that if you use your previous and the rate of improvement and all that, you find that the next target is based on a more realistic number or percentage. I hope I've answered that.
Okay, I think that was the only question on the YouTube channel. So there's another question here. I don't know if this has been answered by Belit. What standard or proven frameworks can we use to evaluate digital solutions implementation, or do you recommend? I don't know if that's been answered actually.
What standard or approval frameworks?
Yes, can we use to evaluate digital solutions, or do you recommend?
Okay. What standard or approval frameworks can be used to evaluate digital solutions?
Yes, digital solutions implementation.
Okay. We can look at with the evaluation, maybe you can have a look at the WHO digital health evaluation. It has some frameworks that you can be that can guide you. WHO is World Health Organization. It provides some guidance on the indicators as you're measuring them, and of course, when you're looking at the indicators, don't forget the different measurements, the effectiveness of an indicator. You may want to look at maybe the safety. So basically, WHO has, to be precise, you can look at that version of 2016. You can also have a look at the Ministry of Health digital health guidelines. You can get familiar with the different frameworks. Yeah, I think those
Yeah, and maybe
can
I
be very
can do an
useful.
addition.
Mm.
Yeah, so related to what Elizabeth has shared. So I think the participant is wondering, okay, how we have programs going on, how do we approach? Are there any standard kind of frameworks to follow? Yeah, of course, all this that we are sharing, already this session has been telling you the how part of it, how to measure the progress, the results. So the framework kind of arrangement that has been shared in this session is the core of the how. Because if you are able to articulate your inputs, what you need to do, if you are able to articulate the results you intend to achieve, then exactly you are doing the real work of how to measure what you are intending to measure. But of course, surrounding all that, you may also need some procedural guidance on what to do, when, which people to be involved. So all that information can still be put together in some kind of plan as you work along. But if you are looking for some kind of procedure, do this, do that, one that Elizabeth has provided is that WHO guidance on evaluating digital health interventions. It's available. And if you were careful in session 1, it's among the resources that were shared on the last slide. And of course, there are also other literature that is available online, which you can always check, review the literature and find out how different stakeholders in different countries, in different implementation environments have assessed or have applied M&E in their digital tools. So again, if you can follow well the reading resources that were provided in session 1, you can get more details on how to go over that. Over.
All right, so to quickly add to the guidelines that have been shared by Justus and Elizabeth, so there is the World Health Organization. Justus has mentioned some other words. Even what we've shared here already is a framework. But if you are looking for like toolkits, you can also check the World Bank. So the World Bank has this digital health maturity assessment toolkit. So it has in it, then you can find steps on how to conduct digital health maturity and some questions you can ask. So there are some other toolkits that are there from the previous World Bank group, how will I call it, resources. So you find common indicators from digital health assessment tools. You can use Global Digital Health Index and maturity model. So there are a lot of them on this inside this specific document by the World Bank. So they're like frameworks, even for cybersecurity, for digital pandemic preparedness, early stage digital health investment tools. So it's a lot of toolkit here. So if you want what has been done before and how you can just follow that template, I think these are some guidelines you can also use to establish what you are doing. So we'll download this and upload it to the folder you'll be getting later this evening. I hope that also works for you. All right, so I think we've really come to the end of today's session. Thank you to everybody who had contributed. We hope you got a bit of clarity on what's it called now, on framework. So please join us tomorrow for the third session. Third session, right? Day 2, session 3. We'll continue the conversation. We've spoken a lot about the framework. Now tomorrow we'll be talking about how do you collect data to actually measure this to measure progress, impact, and all the indicators that have been shared today. So tomorrow we'll be going into data collection and management in digital health. What kind of data should you collect when you are doing your M&E, and how should you collect it? So join 10 a.m. West African time, same link. If you're unable to join Zoom or you have somebody, you can let them join on our YouTube channel. It's currently streaming, and you can always rewatch on YouTube. Before the end of the day, you get a link to all of these slides and resources that have been mentioned on the call. So please do well to check your email. Also for announcements, please, your case study, you need to submit on Wednesday next week. You also need to fill the pre-assessment form for you to get your certificate. So those are the criteria to get your certificate. On Saturday, which is the last session, we'll call on some of you to present your case study so that you can get feedback from the facilitator. So you have access to review what you've done on the case study. So prepare to present. We can call on you to actually present your case study, what you've done, how you've done it, and our facilitators will give you feedback, if you've done well, what you need to improve, and so on. So thank you so much for joining today. See you tomorrow morning. Bye.
Thank you very much. Bye.
Bye. Have a great day.